Side and freezing temperature.
A hospital autopsy usually and a forensic autopsy or medical legal autopsy is here with a forensic autopsy, we have to look at everything in situ. We have to where how it lies in the body. We're looking for trauma. We're not looking for just medical problems. We're looking sometimes at the chest wall. We're looking at the abdominal wall.
And as she examines the body, what is immediately clear is Mr. Adler's poor state of health. His lungs show signs of emphysema, a chronic and sometimes fatal pulmonary disease that is caused by smoking in 80% of all cases.
Lung tissue is destroyed. They are overinflated as if like it's a balloon with air.
And
Yo, what up, man?
Years of
What you doing?
plaque or atherosclerosis.
Chilling.
Mr. Adler's diseased lungs
What you getting into?
are troublesome. If the circumstances
Watching some, what we watching?
doctor might conclude that Mr. Adler died from a heart attack.
I don't know if you heard of Dr. G.
It would be clearly a result of that heart with that lungs. But that's why you have to take everything in context.
In this case, the scene suggests that Mr. Adler did not simply die from natural disease, but that his death was due to trauma, perhaps from an assault, and that he died while lying on the ground during the frigid ice storm.
We really have to just see what kind of internal injuries he has, and is it consistent or not consistent with somebody beating him. Okay.
Next, she removes each and every organ from the body so that she can inspect the inside of the empty abdominal cavity for any internal injuries. And there, she finds something unusual. Mr. Adler has 6 broken ribs along his back.
Yeah, I couldn't see it with the lungs in there. It says he has some rib fractures. We've got trauma. We've got rib fractures on the left side, kind of the posterior aspect of 6, 7, 8, 9, 10, and 11.
But the fractures are very unusual. The 6 ribs are broken in a clean, distinct line, which stretches to the spine.
And it's one after another in a line, very sharp. And the ribs are like the bars. And then the back is broken. At T10.
There is only one way that an injury like this can occur. The fractures are clearly not from a blow with a fist or an object, but rather from an impact against a hard edge, such as the lip of a cement patio.
He did that himself. Line where he hit, really sharp, and then it ends at the broken back. So he as he's going down, he hits against the side of that patio. It'd be very painful. All of this would be very, very painful, and cause him to just lie right there on the ground.
In a young person, a fall like this might result in minor injury, but in a 92-year-old, the fall is devastating.
Elderly, falls are more dangerous for elderly because they have more brittle bone over time. Both men and women lose the strength of their bones. They lose calcium out of the bone and they more easily break.
Dr. G now believes that Mr. Adler died from the trauma of the impact. But based on the significant natural disease discovered earlier, she concludes that Mr. Adler's heart and lungs were most likely a contributing factor to his death after all.
If he breaks a bone, there's a lot of stress, there's a lot of pain, and it's cold. All of which is coming down on him to the point where his heart doesn't have a lot of reserve. So we definitely have an answer that trauma was involved in his death. Most likely from what appears here that he's fallen. Okay.
But if Mr. Adler died in a fall, this explains only one part of the bizarre and troubling death scene. Still unknown is what he was doing in the backyard in the first place, why he fell, and whether the fall occurred during an assault.
So we're sitting here going, here we got trauma, but why is he out here? Why is the front door open? So this is when we started trying to rebuild what this guy was doing.
Though she's determined the cause of Mr.
That's
Adler's
that
death,
pie head and you kicking in wanting that
his
sugar.
body might still hold the clues to understanding this complex and puzzling case. Coming up next, Dr. G opens Mr. Adler's brain, searching for anything that might clarify the unusual circumstances of his death. And she finally finds what she's looking for.
He's got actual loss of tissue of the portions of his brain.
And in Dr. G's next case, it's one of the worst infections this medical examiner has ever seen.
This man's got a black leg where the flies have laid eggs in the dead tissue and the crickets have hatched and they're eating it.
When Dr. G, medical examiner, continues.
I think you got walking around like that.
Dr.
That's
G's
bullshit.
more
Why did they
focus
change the
is
name?
from 92-year-old Richard Adler. During the internal exam, Dr.
That's
G
probably not even his
that
real
the
name.
elderly man died from trauma in a fall, combined with a diseased heart and lungs. But the cause of his death still doesn't explain exactly what happened to him. Why was Mr. Adler in his backyard? Why was the front door ajar and the back door damaged?
Could have went to go get a cigarette.
What caused his trauma? Dr. G wonders if findings in Mr. Adler's brain might help explain the troubling circumstances.
That's why I tell you to look at the ground when you walk.
Hi, I'm Everett. My friends would say that I'm a modern Renaissance man.
The Scobie for PrEP helps protect against HIV.
But he was an old, stubbornly independent
Talk to your healthcare
90-year-old
provider to find out if the
veteran.
Scobie right for you. The Scobie doesn't prevent other sexually transmitted infections, so use safe sex
I don't
practices.
know what they said.
You must test HIV negative before and at least every 3 months while taking the Scobie. Tell your healthcare provider right away if you think you were exposed to HIV or have flu-like symptoms. They may be able to test you for HIV.
I
Serious
think
side
they
effects
said
can
that
occur.
he might have had
Any problems with kidney
something.
health. Rare life-threatening side
So he
effects.
was trying to live by himself,
Gas and liver problems. The most common side effect
even though he had a caretaker that
Tell
could
your
do it
healthcare
every once
provider
in a
about all
while.
the medicines and supplements you take.
That's how they
Or
found
have
it.
kidney or liver problems.
The lady came over to care for him,
Don't
and
stop taking the Scobie without
the
talking to
door
your
was
healthcare
open.
provider.
Figured he was
Hepatitis B
outside.
works.
Looked in the house, wasn't there, so went outside. Went in the front yard, so she started panicking and went to the backyard and found out the door was open.
What
And
keeps
there you are.
baby's skin
Oh,
healthy?
wow.
A diaper that doesn't leave skin wet. That's why Pampers Swaddlers absorbs wetness better. For up to 100% leak-proof protection and 0% skin irritation. Pampers for healthy baby skin.
They're so lazy. You only wanted like one. Oh, yeah, it was one.
Oh, wow.
You should have heard you probably wants that big juicy motherfucker. Yeah, wait for the baby to grow up. That thing was huge. I wonder if it was gonna turn into a butterfly.
Yeah, I bet you was huge.
First, she inspects the top of Mr. Adler's skull to make sure he did not suffer any blow to the head when he fell. However, she finds nothing abnormal.
When I reflect the scalp, I don't see any contusion or bruise.
Then she begins to examine the brain itself. And here she does find an abnormality, but it's not trauma. It's brain atrophy. Mr.
Oh, yeah.
Adler's brain has shrunken. There are wide open abnormal gaps between
Definitely.
the coral-like folds of the brain. It appears that Mr. Adler's dementia was more significant than previously thought.
He's got actual loss of tissue of his brain, which is typical of what we would see in advanced stage dementia.
Dementia is a disorder caused by the death or impairment of nerve cells in the brain. There are many kinds of dementia, but the most common in people age 65 and older is Alzheimer's disease, which typically causes memory loss, confusion, agitation, and even depression.
Could be Alzheimer's. I can't say by just looking, but most likely.
For Dr. G, the forensic evidence of dementia in Mr. Adler's brain is critical to the case. She believes that the finding of impaired brain function, along with crucial information provided by investigator Hansen, finally provides answers to many of the perplexing questions that surrounded Mr. Adler's death. Why he was outside, why the screen was torn, how he was injured, and more importantly, at the end of the autopsy, Dr. G can now surmise how long Mr. Adler suffered while lying alone on the ground. Based on investigator Hansen's report, Dr. G knows that Mr. Adler's caregiver left his home at approximately 2:30 in the afternoon, as she usually does. Dr. G believes that sometime in the late afternoon, Mr. Adler is drawn outside, but it's not due to an intruder. He most likely just goes to check the mail and leaves the door ajar.
If you go out and check the mail sometimes, you don't bother to close the door because you're just going in and out.
Despite the cold, Mr. Adler does not wear a jacket or take his cane.
Here we've got a gentleman who's pretty mobile. He can take care of himself, but his dementia's starting to catch up with him a little bit. And sometimes he forgets stuff.
But the day's mail has not arrived yet. And it's perhaps at that moment that the elderly man, suffering from advanced dementia as discovered in the autopsy, suddenly becomes confused. Rather than return inside through the wide open front door, he walks around to the back door. But it is locked, and Mr. Adler, once confused, now becomes agitated.
He's panicking. He's trying to get into the house. He's trying the door and cuts himself on the back screen. He's got blood in different areas. He's trying the glass door, the screen doors. He takes his glasses off that has a little blood on it. So now he's not seeing as well.
Confused, blinded, bleeding from the hands and knuckles, and cold, Mr. Adler walks across the cement patio, which is covered with a patch of ice. With his glasses off, he probably does not even notice the surface is slick until it's too late.
He slips on the ice on the edge of the patio. As he's falling down, he very sharply on the edge of that concrete breaks 6, 7, 8, 9, 10, 11, and breaks his back. He gets on the ground, still alive.
Mr. Adler is not paralyzed, but the pain from his injuries is debilitating.
He's in a tremendous amount of pain. He's not going to be able to breathe as well.
Oh yeah, we definitely gonna be sure parents.
Is causing him not to expand his lungs fully. The stress of that situation would put even more stress on his heart, causing it to pump faster and harder.
The trauma exacts a fatal toll on the elderly man. He struggles to breathe. His heart, weakened by disease and the stress of the trauma, and cold, falls into a deadly arrhythmia, and then ceases to beat. Evidence from the autopsy and the scene support the events that Dr. G believes led to Mr. Adler's death.
This case definitely hinged on those findings at the scene. We can never do an autopsy in a vacuum. Sometimes the findings of the scene tell us more than what the autopsy does.
The findings also tell Dr. G how long Mr. Adler suffered in the cold, a pressing question for his family.
His main concern of his family is how long he was out there and did he suffer.
They didn't care to check up on him,
That his
so
injuries
they
and
can
his
now.
poor health. Dr. G believes that the frail elderly man likely succumbed quickly.
They were very relieved to know that he didn't spend the night out in the cold suffering. That it was I can't say that he died, instantaneously. I have to tell the truth. And he was probably in a lot of pain, but the pain didn't last long. It was probably just a few minutes.
For Dr. G, the death of Richard Adler is especially poignant. It shows the difficult struggle that the elderly face to maintain their independence as they age. It's an issue that Dr. G has encountered with her own mother, who, like Mr. Adler, lives alone.
I'm clearly worried that she's going to fall and nobody's going to be there. But that's her decision. She doesn't want to lose her independence. She likes being in her own house, and she has the right to make her own decision. And I would just know I have to accept that. I would rather have her fall and not be able to get up than put her in a place that I know she's safe, but she's miserable. So no one can weigh it. And every family makes a different decision.
Coming up next, a 55-year-old
It's crazy
man
going
dies unexpectedly in an outpatient clinic.
He had terrible lesions of his legs.
For any forensic pathologist, working a murder case is always a challenge, especially when the crime took place nearly 30 years earlier, such as Dr. G's next case, Dennis Fulton. The body of 55-year-old Dennis Fulton arrived at the morgue yesterday afternoon.
I got a call yesterday from the nurse from the VA clinic, and this unfortunate fellow was brought in by his family for mental status changes. The VA really didn't know much about him then.
As a first step, Dr. G reviews the investigator's report to learn what information has been gathered about the victim so far. The report states that the decedent had been a paraplegic for 30 years, the result of a gunshot wound suffered in his 20s.
Damn.
Dennis managed his paralysis well for many years, but his medical records indicate that in the past few months, his health had begun to deteriorate. 3 weeks ago, Dennis was hospitalized due to infection, chronic high blood pressure,
They didn't remove the bullet.
disease.
He has a lot of problems with his paralysis, as oftentimes they do. He had recurrent urinary tract infections and very bad bed sores that he was being treated for. They also know he had a bad heart.
But as she reads further into the case file, Dr. G learns that Dennis left the hospital only a few days after his admission, before his treatment was completed.
He left that hospital not because he was cured, but because he wanted to leave. He just kind of went out on a pass and for return, so they decided he was discharged, I guess, against medical advice.
Then, only 20 days after leaving the hospital, Dennis is beset by illness. He loses consciousness and his family cannot wake him.
So he wasn't acting right, he was really sick. Basically, he was unable to be aroused.
His wife immediately rushes him to a nearby clinic for care, but it is too late. Dennis is already dead.
Just dead right there in the waiting room.
The case leaves Dr. G with several possibilities. First, she considers Dennis's 30-year history of paralysis.
They're doing wonderful things with people who are paralyzed now, and they have a lot more to offer them. The lifespan used to be fairly short. It still is not as long as you'd like it to be.
You fall asleep, man.
Many,
What time?
Oh, sleep.
and even live 20 years out. And some of those, because 30 years out, and if you're not taking care of yourself, you have to be really motivated to take care of yourself.
She also weighs Dennis's history of heart disease. During his hospitalization 3 weeks earlier, doctors found that Dennis suffered from ischemic cardiomyopathy, a critical reduction in blood supply to the heart due to coronary artery disease.
You always got
Doing this sick.
cardiomyopathy, the heart muscles are damaged. Maybe he's just running into heart failure and not getting enough blood to the brain.
Was it natural disease or a complication of his paralysis that took Dennis's life so unexpectedly?
We have to look at what's going to cause you to be slowly unarousable. Could it be a lack of blood flow to the brain? Could his heart be failing? Or what is wrong with him that he can't be aroused?
The only way to find the answers is through a full autopsy, beginning with the external exam.
They're saying they couldn't get up.
Mm-hmm.
That's blood flow.
When
What?
Dr.
He
G
shouldn't
gets
even be
information
getting
from
up
his
anyway
doctor,
since he's
she
paralyzed.
cannot believe it's poor
So what's that got to
condition.
do with anything?
Basically, when you see him, these are bed sores, the worst I've ever seen. They start on his hip, especially on the right, and his entire leg is necrotic and dying. There's exposed bone. The bone joint has been somewhat eroded from it. It obviously infected. There's obviously gangrene, and some of it's black, some of it's green. He's got just an full infected right leg. It's partly necrotic and black, and areas of some of it's dry gangrene, some of it's wet gangrene.
From hospital records, Dr. G knows that Dennis was treated for infected bed sores, also known as decubitus ulcers, which are a common complication of paralysis. But Dennis's bed sores had clearly worsened since he left the hospital. His flesh has actually begun to decompose, and it is infested with maggots.
There's actually even maggots that have gotten into it. I mean, flies have laid eggs and hatched in this wound, and they're feasting on this dead tissue.
The infection is so severe it could have actually caused Dennis's death. This possibility adds a new twist to the case. If Dennis died as a result of his infected bed sores, it would mean his death was caused by a complication of his paralysis. And because his paraplegia was the result of a shooting decades earlier, his death could ultimately be
No.
a homicide.
No.
30 years later, what
That's his own damn fault for not taking care of it.
His cause of death if he died from the bed sores.
It ain't got nothing to do with murder now.
But with stakes this high, hunches aren't enough. Before Dr. G turns this case over to the district attorney as a potential homicide, She must verify whether or not it was an infection that killed Dennis
Dog.
Bolton.
Hey, yeah, I forgot it.
We got each case, especially very old one, is did that criminal act cause this death, even if it was much later?
To find out, Dr. G needs to complete the autopsy. Coming up next, Dr. G opens Dennis's body and discovers another possible cause of death.
And it would be a heart disease that would kill most people.
But did it kill Dennis Bolton? When Dr. G, medical examiner, continues. Dr. G's morgue technician, Arden Monroe, prepares the body of Dennis Bolton for the internal examination. The 55-year-old paraplegic man died yesterday afternoon in a local clinic. During the external exam, Dr. G found that the victim's legs were massively infected from bed sores.
It starts at his hip, it goes down the back of his leg, even into this calf is all black.
If she determines that the infected bed sores from his paralysis actually killed him, then the ultimate manner of Dennis Bolton's
I don't get that though. That's so fucking stupid. It's just I'm retarded fault for not cleaning up or actually calling somebody like the fucking ambulance comes to you for heaven's sake. So he's ignorant.
You have to prove it.
He killed himself.
What killed him?
If it was to do with
What we got in there with you, Charles?
Talk about your IBS demo. Maybe later. Hey, because IBSD is often a multi-symptom condition and talking about it can help. How about now? There's a short-term treatment for lasting relief. Okay, let's talk. It's called Xifaxan. Xifaxan with an X. It's a 2-week treatment for adults with IBSD that provided lasting relief from both abdominal pain and diarrhea and helpfully bloating and urgency. Think of it like a short-term treatment for lasting relief. Don't take Xifaxan if you are allergic to its components, rifaximin or rifamycin antibiotic agents. Get help right away if your diarrhea worsens, as this may be a sign of a serious or fatal condition. Tell your doctor if you are pregnant or plan to be, have liver disease, or are taking other medications, as they may increase the amount of Xifaxan in your body. Most common side effects are nausea and decreased liver enzymes. Right time to talk to your doctor about Xifaxan is right now. Xifaxan.
Total Wireless, they got your back every day. Others, not so much. Just look at the facts. We run on America's most reliable 5G network for as low as $25 a month. They don't. Not that. We lock your price for 5 years. Not that. Back that. And we'll give you a free Samsung A35 when you switch to any of our phone plans. So back those guys, right? We've got you covered. Get the facts and switch to Total Wireless.
Before the body of Dennis Bolton is opened, Arden Monroe washes the maggots off of the body. Once the body is cleaned, Dr. G opens Dennis's torso from the shoulder blades to the pelvis. Immediately, she encounters scar tissue in his chest cavity. It is undoubtedly from the gunshot wound that paralyzed him 30 years earlier.
When I open them up,
You still killing him?
your lungs
Yeah.
sit nice and loose in your lung cavity. Your heart sits nice and loose in your
I'm thinking about
pericardium.
playing the game for real.
Your lungs sit nice and loose in the lung cavity so they can move. Well, in his case, he's got a lot of
Or one never makes a noise.
between the surface of the lung and the surface of the pleural cavity, which is where the lung sits, and between the surface of the heart and the pericardial sac, which is where the heart sits, which tells me that he's had trauma in that area.
But also evident in the victim's body cavity are visible signs of a raging infection.
You get an overall sense that his tissues are kind of softened. The tissues don't have the same nice, healthy color to them. A lot of it's because with the infection, they have a lower and lower blood pressure. And so he didn't look well on the inside, just like he didn't look well on the outside.
But is the infection that ravaged Dennis both externally and internally what killed him? The answer can only be found under the microscope. If there is an increase in white cells in Dennis's internal organs, it would be a telltale sign of a deadly infection. But at this point, even without microscopic evidence, Dr. G believes Dennis's cause of death is obvious.
You know, it's looking like this is going to be complications of the paralysis due to that gunshot wound.
No, it's not.
However, when
It's
she
due to
begins
him
to
not
examine
fucking
Dennis's
cleaning
heart,
it.
the course of the autopsy suddenly shifts.
He had a clearly diseased heart. It was
Gunshot wound happen all the time in war.
He has diseased vessels to the heart. The coronary arteries or blood vessels that supply blood and oxygen to the heart were narrowed.
One coronary artery is 80% blocked with atherosclerotic plaque, another 95%, and yet another is 98% blocked.
See this one? You can see that where the blood is supposed to be. Yep. And then if you go down, see where there's not much left where the blood is supposed to be. Okay. You see it? The only hole is right down there. It's tiny, tiny little hole. Now the blood's supposed to go through there? Well, it can't.
It's evident that the blockages chronically reduce the flow of blood to Dennis's heart. Dr. G now wonders if he simply succumbed to a massive heart attack. And
Yeah, pot here, there you go.
It would be heart disease that was bad enough, certainly, to have caused him to die suddenly and unexpectedly at any time. And a normal man in the right circumstances, I'd said he died from his heart.
However, Dennis Fulton is anything but a normal man. His legs are black and gangrenous with infection. So which caused his death? An infection linked to his paralysis and gunshot wound, which would lead to a homicide charge? Or did he die from unrelated heart disease, a natural death? There's only one way to know for sure. Dr. G must scrutinize the samples taken from Dennis's organs, including his heart, microscopically. Coming up next, slides are back from the lab and Dr. G faces a difficult ruling.
And even in that heart, I was particularly concerned that there was nothing acute.
When Dr. G, medical examiner, continues.
Yeah, you would hope to charge somebody with something that's not there. Like we all do.
Dr. G has just received slides of tissue samples she took a few days before while performing the autopsy of 55-year-old Dennis Fulton. During the examination, Dr. G discovered massively infected bed sores, a complication of the victim's paraplegia from being shot 30 years earlier. However, she also found significant heart disease. The question is, which actually killed him?
And that's the big question. Because if the paralysis killed him, it's a homicide. It's complications of that gunshot wound.
Dr. G examines the slides of Dennis Fulton's heart tissue and other organs. Under magnification, she finds no necrotic or dying tissue that would indicate he suffered a fatal heart attack. But in his liver and spleen are the unmistakable signs of a life-threatening infection.
He had a tremendous amount of white cells throughout his body, a collection of them in his spleen. So he does have evidence that he had an overwhelming infection.
The forensic evidence points to a death from infection, not a heart attack, and so do the circumstances of the scene. Dr. G's conclusion: Dennis Fulton's death is directly linked to the shooting that paralyzed him 30 years
Oh
ago.
my god, you fucking retard.
This case.
She stayed bitter
a
stuff
homicide
then.
investigation.
Once I decide that this man died from infection, which was initiated from him being paralyzed, I then have to.
Bye.
I heard a woman's voice, so I knew it was safe. And somebody said, "Is there anybody in there?" And I said, "Yes." They said, "Are you hurt?" And I said, "Yes." "Are you shot or stabbed?" Well, I really was slashed, but I didn't have that option, so I said, "Stabbed." Just as quick as they took me out of the trunk of the car. I said, "Mitch at the church did this." By that time, they had evidently called the ambulance, and so they were lifting me out, and my lips were blue, and my face was white, and my hair was red. These are red,
I
white,
changed
blue.
her dumbass.
Oh shit.
Well, and when they told me.
You I'm out of here.